Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. I think everyone knows about the precautions because whatever the precautions we have taken for COVID, same precautions are applicable here. First one is try to get the vaccination, sit at home, unnecessarily don't go out, wear a mask, don't go into the crowded places, keep social distancing, have plenty of ventilation at home and at office, wash the hands with sanitizer or soap, maintain respiratory hygiene, avoid if there is take the symptomatic treatment, always clean the surfaces, avoid traveling and try to be isolated when you get the symptoms. Take the flu vaccine. The patients with bronchial asthma or bronchitis or any other respiratory disease and heart diseases should be very careful because they have higher risk of going into primary pneumonia and secondary pneumonia in future. As per World Health Organization, this vaccine has to be taken and it is mandatory for few risk factor people. What are those? First one is pregnant women. Pregnant women should be vaccinated. Next one is child between the age of 6 months and 5 years should be vaccinated, and also an elderly individual above the age of 65 should be vaccinated. Individuals with chronic medical conditions like heart diseases, lung diseases, or any other chronic kidney diseases should be, and also healthcare workers like doctors, nurses, and any other staff within the hospital should be vaccinated. Yeah, once you are diagnosed with this disease, take very good food, take mild food, don't take oily food or spicy food. Keep the things bland, take plenty of vegetables and fruits. And also, you have to take good rest because the body will be weak, and also, you have to have plenty of sleep. Do not exercise when you have this disease. What about the prognosis of the disease? It is not treated properly, or once you don't take care of it, what happens is you may land into primary pneumonia, the pneumonia which is caused by the virus. Sometimes after 1 to 3 weeks, if the symptoms are continued, it may land into secondary pneumonia due to bacteria and also respiratory failure, low levels of oxygen. uh, Normally, it is a self-limiting disease. In 99.9% cases, there will not be any death. It is not so dangerous compared to COVID, but you have to be very careful. What you have to be very careful is very simple. If the disease occurs in clusters, from there new strains may occur. It is very difficult to control the new strains because we don't know how they behave. That is the reason, try to curtail this disease, try to isolate yourself and take all the precautions so that the disease will not spread.